Welcome to Your Care, Your Choice, a podcast brought to you by Community Nurse. Over the last 100 years, we have prided ourselves on continually evolving and developing new and exciting initiatives to better serve you and your families. This podcast is one of our most recent examples. I am your host, Dr. Todd Hayes, physical therapist. We have a great episode planned for you today. Maybe we'll get you learning some new things. Hopefully we can improve your lives. Let's get to it. Welcome to Episode 2, Part 1, Caregiver 101, where we will talk about some strategies for surviving the role as a caregiver. When we're placed in the caregiver role, it can be overwhelming. Few of us have the training to prepare us for this role. But because of our experience working with acute and chronic injury recovery in your home, us at Community Nurse have a unique perspective and skill set that we'd like to share with you. In this episode, we'll review some basics to get you started on the right path. No one person is a perfect caregiver. It often takes a team to get it right, and no one can do a perfect job 24/7. So above all, be patient and be kind. This episode is meant to serve as a guide and not be the end-all be-all of the caregiving role. It's not meant to be any kind of training session, and it should never override any advice you get from your medical professionals. We're targeting this episode at people who are caring for someone who's likely suffered a medical event and things have changed rapidly for you. They're coming home, and usually we're talking about someone who's a little bit older, so either a parent, a spouse, maybe even your neighbor. Though almost anyone that's put in the caregiver role could glean something from today's episode. Try to remember that the dynamics of your relationship with that person will have a big impact on how this situation can proceed. If you've had strife in the past, it's likely to come to the surface. If the person is a little more controlling, you're going to see some of that come out. Keep in mind that the person that you're caring for is also going through something significant. And oftentimes the stress can build. So hopefully with some of the information we give you today, we can help make the caregiver role a little bit easier for you and certainly a lot more successful. All healthcare settings will provide you some education about the person's current condition and any kind of restrictions. But being taught doesn't mean that you're learning it all. And those two things rarely happen at the same rate. It took us a long time to learn the skills that we need to be able to do our jobs, and we don't expect you to learn things overnight. So take your time. And as I said, be kind and be patient. So your loved one has been discharged home and you're put in the lead role to take care of them. The first thing you should do is take a deep breath. Let's assess the situation. If it's a planned situation, like a hip replacement, knee replacement, shoulder replacement, or any other planned surgery, then great, because you can do some preparing and be ready. If it's a chronic condition that has flared up, most likely you know something about what's going on with this person. But for a lot of us, this is an acute situation and it's a surprise. So just the shock of what has happened can be a lot to handle. And now you need to receive this person. So try to familiarize yourself with their medical condition the best you can. There's a lot to learn. Don't go too far, right? The internet could be a double-edged sword, so be careful. It's good for basic information, but again, you don't want to override any particulars or instructions that you've been given from your healthcare professionals with anything you find on the internet, and try not to go too far into a hole there. Again, the hospital staff or the rehab staff will help you and will try to teach you. And then those of us at Community Nurse do an excellent job at educating our patients and caregivers as to their current situation. Understanding the medical situation that the person is in and their needs will really set you up for success. So try to take some time to familiarize yourself. Keep in mind that communication is a key aspect of caring for a loved one. Um, Communication between you and the person you're taking care of, communication between you and the rest of your family or your social circle. We often hand out calendars when we onboard our patients because there are usually a lot of follow-up appointments to worry about, and a universal calendar can help organize your time and keep you abreast of what's coming around the corner so you can plan appropriately. Uh, Things can get overwhelming very, very quickly. So having some organization in a method to what you're trying to do here is very important. You can use a paper calendar to leave in the home, but with the prevalence of smartphones and devices nowadays, digital calendar is excellent. It can be a quick way to reference when doctor's appointments are coming, but you can also use that to coordinate care with other caregivers that you're going to bring into the fold. You should not be trying to do this alone. Also, a notebook or communication log can be helpful. Just to write notes for yourself for things to remember, leave notes for other people, or status updates for the home health staff. It seems like a little bit of work, but with all of these things, a little bit of effort can go a long way in the long run. Text strings or social media groups, Facebook groups, can be very helpful. You can have these closed groups or public groups, and you can use them to provide updates on the patient's status to the rest of the people in your social circle. And that really cuts down on unnecessary phone calls. Everybody is interested, especially in the beginning. Everybody wants to try to help, and you'll be inundated with phone calls, texts, and visits of different people who mean well, but can usually add a lot to the stress. So any way that you can cut down on that and streamline your communication is effective. Keep open channels with your loved one's doctors and the home health staff. Keep them up to date with what's going on. Please don't change anything, especially with medications, without talking to a medical professional. And medications are probably your first obstacle to overcome. If the person's coming out of the hospital, they're likely to have some new medications. Maybe some old medications have been removed or changed. It's best to use, for this situation and any situation going forward with caring for a loved one, something I've heard called the KISS principle. Keep it simple, silly. Don't let things get overcomplicated. A lot of people are very resistant to change, and we have a hard time accepting help from others at times. So accept your help early, accept it often, and try not to think of things as far as what you need in the moment versus what would be the most beneficial. So using a pill planner is probably one of the simplest, easiest tools you can use to keep it straight and keep it simple for yourself. You can use planners that have little trays for morning, noon, night. Sometimes they're just one tray. You can use all manner of pill planners. They even have on the internet, you can find automatic pill dispensers that you fill ahead of time, and alarms go off and remind the person when to take their pills even. Try to keep a schedule. With most of our patients coming home with a new pain med schedule, it's best to put the doses and times in your phone with alarms, or in the person's phone with alarms. It takes a lot of math out of the equation, and it reduces the amount of thinking you have to do during the day. When is one pill due? The alarm goes off. You see what the pill is. You just give it to the person as they need. A lot of times people are resistant to these types of medication planning procedures, but medication errors are one of the main reasons people are rehospitalized after being discharged home. and it can adversely affect their health significantly. Make sure you familiarize yourself with any special instructions, weight-bearing restrictions, lifting restrictions, fluid restrictions, other dietary restrictions. There's all manner of things that can be changed in a person's lifestyle when they're discharged home. The more you understand what's going on, the more you can help that person in following those instructions. Also, try to familiarize yourself with the main side effects of the medications so that if anything adverse does start to happen, you'll be more aware of it. And your home health care staff will help you with that as you go. And try to remember, be patient and be kind. Right? Everybody makes mistakes. You're not going to be perfect. So once you have the medication situation under control, now you want to take a look at the home environment. What kind of home are they coming home to? Is it their own home? Is it your home? Each situation will have its own challenges and benefits. So if you have the ability, do a walkthrough and try to look at the environment from a fresh set of eyes. Are the pathways clear? In general, we want about 3 feet to be able to move through the home, especially if the person's coming home with a new assistive device, a walker or a cane. You want to reduce the trip hazards, frayed rugs, cords, child toys or pets or children themselves. You have to be wary of. They move erratically and they love to be at your feet. Does the environment have stairs? That's a major limiting factor in the home. The fewer stairs, the better. And a lot of times that can make the difference between whether a person goes straight home or has to go to another setting, such as your home. Take a look at the bedroom. Are there clear paths to allow them to get to and from the bed easily? Are they able to get to clothes and other necessities that they'll have? Please don't be afraid or resistant to moving furniture a little bit. Moving something a few inches can make a big difference for a person's safety. And nothing ruins a good recovery like a hard fall. Everybody's in their weakened state when they come home. Then they're not going to respond very easily. And if you hurt yourself again, things are going to get a lot more complicated. So, clear things out, make room to move freely. Again, it seems like a little bit of effort. People are very resistant to change, but it's an important step for making your healthy transfer home from the hospital. Also, take a look at the bathroom. A lot of times there's clutter in the bathroom, unnecessary furniture, decorations. Again, we need clear pathways to be able to get to and from the toilet, in and out of the shower. You got to look at those area rugs that might look so pretty when you bought them, but major trip risk there. So your home health staff will work with you on that if you need some help. Another thing that we often overlook is the lighting. We want to make sure that there's good lighting in all rooms, especially at night, right? When the sun is down. Night lights can be very helpful. Make sure you have an illuminated path from any bedroom to the bathroom. Most falls that occur in the home occur at night and either in or accessing the bathroom. So it's a real risk. And with a little bit of effort and some forethought, you can avoid those unnecessary risks. The other part of your environment would be the equipment. If the person's had a downgrade in their functional status or abilities, they might need a walker or a cane, as I mentioned a little earlier. Some of the things that they may need might come directly from the hospital. And in that case, excellent. We'll be all set. But not all things are covered by insurance. And there are a lot of different devices out there that don't require a doctor's order, but can be very beneficial for your home environment. Again, the community nurse staff can really help you out with that as we do our assessment of the person and how they're moving through the home. So try not to get too ahead of yourself and start ordering all kinds of equipment before anybody's come in to take a look at the home. We can help you with obtaining walkers, canes, or items for bathing and dressing. They even have special tools to assist with eating and drinking and accessing the bed, the toilet, or even your shower. So the internet is a great resource for this, but again, you have to be very careful. There are a lot of different options for many different devices, and they range from gimmicky to very useful. And again, staff can help you with that, as well as other people in your social circle who might have been through something similar in the past. You can get this equipment not only from the internet, but other durable medical equipment companies, or possibly your council on aging. A lot of the councils on aging in the area have equipment closets that you can borrow equipment from free of charge and return when you're no longer needing it.
Okay, let's take another breath. We have the medication set, we've looked at our environment, and we have all the equipment that we need. Your loved one is safe at home. So let's pause here. Caring for your loved one that has experienced a medical event is one of the hardest jobs you'll ever have. It's a unique experience that is often unplanned, emotionally draining, and financially overwhelming. Things can change quickly, and few of us have the experience necessary to do the job well. No one should face this responsibility alone. When it's time to choose a home care provider, choose Community Nurse, and we'll help get you through. If you have an idea of something that worked really well for you, or even something that didn't, share it in the comments where available. We'd love to know what your experiences are. Also, please don't forget to follow us on the socials. And remember to please join us for part 2 of Caregiver 101, where we'll talk a little bit more about caring for your loved one and the challenges that entails. Thank you for joining us on Your Care, Your Choice. So until next time, let's all try to do a little bit better together each and every day.